Welcome, and thank you for joining us today for our presentation. I'm going to be reviewing common errors for vitamin D assay testing that are seen by our medical review department. My name is Rachel Wood, and I'm one of the nurse analysts with the Provider Outreach and Education team. I'm joined by my fellow nurses in Provider Outreach, Mary Sue and Jennifer. They are going to be helping me with questions as well as monitoring the chat as I go through our presentation today. If you do have any questions as I go through our slides, please put those in the chat by sending those to all panelists, and we will either answer those as they come in, if there's something we can respond to, or hold them until the end and address them to the group. Regarding materials, these were provided through our live events page. So we did put a link to that in the chat, and it sounds like, let's see, yeah, we did put a link to our live events page in the chat, so you can go to that page, find this event title, and then select download material to follow along with our slides if you want to do that. All right, here we have our disclaimer. So if you've attended any of our other education, this is our standard disclaimer. And what this tells us is that our education is for informational purposes only. Medicare changes often, so please make sure that you're looking at those up-to-date Medicare communications for any rules and regulations. These do take precedent over anything I present today. I am presenting on the guidelines as they stand. Additionally, we are recording this and we will post this on our YouTube channel, so no need to record this or photograph any of the slides that I'll go through for yourself. And I do see that some of the resources in our presentation are CMS links, and it sounds like there is some issues right now on the Medicare side on their website with some of those links. So if you're trying to go to our LCD or anything like that, just stand by. That is a technical issue that's a little bit out of our control. So I just wanted to point that out now, you know, as we start talking about our LCD and some more information throughout our slides. All right, so here we have just some basic acronyms as I go through our presentation. If you have any questions on what any of this stands for, refer back to this slide, but these are pretty straightforward acronyms that are very commonly used. All right, so that brings us to our agenda and what the game plan is for today's webinar. So as I said, I'm going to be covering vitamin D assay testing and talking about the necessary documentation that Medicare and our reviewers at WPS are looking for. So our goal is that you as the provider gain a good understanding of the Medicare coverage requirements for vitamin D assay testing. I'm going to start by reviewing the Medicare coverage guidelines for this service, and then we'll talk about documentation requirements, and finally review some common errors that our nurses see during their medical reviews and some of the things they've seen an increase in. We should have some time for questions at the end, and anything we can't answer today or maybe we don't get to, we will respond via email. So if we do need to bring a question back to our medical review nurses, just be aware we will get an answer to you. If it's not this morning, it will be at a later date. With our presentation, I am going to show some documentation examples towards the end, and they were very long examples, so we did take some screenshots of the notes so you didn't have to sit and watch me scroll through 50+ pages of notes. So we do have that towards the end of our presentation as well. All right, so starting with you know, some basic information about vitamin D testing and what this is. So the 25-hydroxy vitamin D test, this is the most accurate way to measure how much vitamin D is in your body. Vitamin D helps control calcium and phosphate levels in the body, so that's why it's an important thing to have. This test is done to determine if you have too much or too little vitamin D in your blood. So it's a simple blood draw, and screening for adults even in pregnancy for low vitamin D. Generally, this is not something that is provided as a routine screening. We will talk about that a little bit more. However, screening for vitamin D levels may be done on people that are at high risk for a vitamin D deficiency, as well as too much vitamin D in your blood, though deficiency is more common. So I will talk a little bit more about those indications as we get into the information regarding our LCD and the coverage criteria. All right, so some of the ways we get vitamin D include our body produces this when our skin is exposed to sunlight. For those that live, in the Midwest, and now that we're getting into the winter months, our vitamin D from the sun is going a little bit, downtrending with those shorter days. We can also get vitamin D through certain foods. So some examples that vitamin D occurs naturally in includes egg yolks and fatty fish such as salmon. Vitamin D is also added to other foods. So some breakfast cereals have that added in. Some orange juice brands add vitamin D into their products, as well as milk and other dairy items. And then finally, you can get vitamin D through taking supplements. There are specific types of vitamin D. So you have vitamin D3, and that is the type of vitamin D our body produces or has made, and that you absorb through an animal source. So again, those fatty fish, or you can get it through liver. You can also get that through a vitamin D3 supplement. And then you have vitamin D2, and so this is what you absorb through foods fortified with vitamin D, as well as a vitamin D2 supplement. So some things that, a provider might be looking for, we might look into the notes for as a sign of why a vitamin D test was needed or wanted for vitamin D deficiency. Some things a provider might look for include issues with bone pain, muscle weakness, frequent fractures or weak bones, low bone density. So as you can tell, vitamin D is very important to our bone strength. All right, and so that's just some basic information about why we would do this test, what vitamin D is important for, and what some of the things providers might be looking for and might flag them to perform this lab test for their beneficiary. On our slide here, we have our local coverage determination, otherwise referred to as our LCD. And so this is what we refer to for the coverage criteria for this test. So this is LCD L34658. And as I go through our slides today, the information I'm talking about can be found in this LCD. Additionally, this is what our nurses use as the basis for their reviews for these claims. All right, so touched on our resource, touched on what vitamin D testing is. Now I want to talk about some coverage basics for vitamin D assay testing for Medicare beneficiaries. The coverage criteria for vitamin D testing is pretty straightforward. So first, the documentation should include at least one of the indicated conditions that are LCD. Again, that's L34658, and I believe we did put a link to that in the chat as well, includes. So this is a very long list, and because of that, we didn't put all of the indications on your slide here. Some examples of what is included in that list in the LCD includes chronic kidney disease, stage 3 or greater, osteoporosis, osteopenia, hypo or hypercalcemia, hypo or hyperparathyroidism, rickets, and vitamin D deficiency to monitor the efficiency of replacement therapy. Our LCD lists a few limitations of coverage that I will talk about with our documentation errors, but I also do want to touch on it really quickly here. So first, limitation, this is not a test that is going to be covered for routine screening. So it's not a preventative test or something that Medicare will pay for unless the documentation supports the test, the reason and the rationale the test is ordered. Our next LCD limitation is that the performance of assays of calcitrol for each condition listed. So WPS will only reimburse one total 25-OH vitamin D assay for a beneficiary on a single date of service. So we will not reimburse multiple tests conducted or submitted on the same day. Again, one test per date of service. And then finally, as this is the case with all payable medical services, this service must be medically necessary, and the documentation that is sent in must support that that is the case. All right, so here we want to just talk really quickly about which jurisdiction we're reviewing claims for vitamin D testing for. So for our TPE, or Targeted Probe and Educate reviews, if you're a provider in J8A, you may receive a TPE review from our medical review nurses for these claims. We do have a list of topics that we're currently reviewing on our website. So if you are interested in that information, you can go out and take a look at that. To sort through the correct information, please make sure you have this, the appropriate jurisdiction selected, and then navigate to the medical review page. Our website did recently go through an update, and every so often we've noticed that the prompt, which should be working now, but the prompt to select your jurisdiction when you initially go to our website hasn't always been popping up. So just double check that if it's not something you see when you go out to that information, that you do have the correct jurisdiction selected, and then the appropriate TP topics will filter on that medical review area. In the slide here, we also have a hyperlink to our article for a successful vitamin D3 test review, and I am going to talk about what is included in that in our next slides here. All right, so we've established, what these tests are, why a provider might order them, our LCD, and some basic coverage criteria for this service. So I want to talk a little bit now about documentation elements that our reviewers are looking for and what providers should be documenting in their notes for a successful review. First item on our slide is the practitioner order for the vitamin D lab test. Now, this is a pretty self-explanatory, in theory, item, but every so often we do receive a claim for vitamin D tests that are not accompanied by a provider order. So these orders must be signed and include the date the test was ordered. Next on our slide here, we have progress note indicating the rationale for the vitamin D test. This would include the patient diagnosis with one of those indications listed in the LCD, and what results the provider is hoping to receive or looking for when they're providing this test. History and physical, as well as medication list. This is typically information that is included in most medical records, but we are looking for that to further support the medical necessity of the vitamin D test. And include documentation of any prior vitamin D lab tests, as well as what those results were. We would also want to know when, so the date of service that those tests were done, and again, along with the results of what those tests showed. And then finally, if this applies, a copy of the signed advanced beneficiary notice of non-coverage. Again, that would be in a case-by-case scenario if that's something that applies to the specific beneficiary. All right. All right, so in the next couple of slides, I'm going to talk about the common documentation errors that our nurse reviewers see with these tests. I'm going to talk about each one on a separate slide, and then we'll review some examples of prior claims that our nurse reviewers have looked at. So with the common documentation errors, we're going to be reviewing missing clinical rationale, frequency of testing exceeding the parameters in the LCD, and then finally, testing for routine purposes. All right, so getting into that information, our first documentation error that our nurses commonly see is missing clinical rationale for the order and performing a vitamin D assay test. So this error goes back to our slide that reviews documentation elements to include for a successful review. We are looking to see that the test is medically necessary and the documentation supports that that is the case. So I know that that is something I've repeated and I'm repeating myself with this information, but we are going to be reviewing the documentation for that information to see that the beneficiary has had one, again, of those listed clinical indications included in their diagnosis. Maybe it's somewhere in the relevant medical history, somewhere in the history and physical that was sent in, or finally, if there is any prior relevant diagnostic testing done or other procedures were done, we would want to know what those were and why those interventions are important and relate to the ordering of vitamin D testing. As a provider, it is very important for your documentation to paint a crystal clear picture to support the clinical indications that are there, as well as why the service that you're providing is something that should be covered by Medicare. As reviewers, we only can go off of what is in the documentation, so please keep that in mind when doing your notes. If it's not documented, there's no way we can guess the rationale, the why, or that certain things exist. Additionally, with that, good documentation helps support good clinical care for future patient interactions with other providers down the line. So all good things to keep in mind when putting your notes together. All right, so our next common error that I want to talk about is frequency of testing that exceeds the parameters outlined in our LCD. So on our slide here, we have what WPS will reimburse, and this includes the following. So 1 25-OH vitamin D level in any 24-hour period, 1 1.25 OH vitamin D level in any 24-hour period, up to 4 assays for vitamin D levels per year for rickets, vitamin D deficiency, osteomalacia, my apologies if I think I mispronounced that, aluminum bone disease, and 1 assay for vitamin D levels per year for conditions other than those listed above. So those are the frequency parameters we will follow, and the reason we are looking for documentation of any prior testing with the results as well as the dates that those tests were done. We often see that providers are submitting claims for tests done at a higher frequency than what is listed here in our slide, as well as in the LCD, and exceeding those frequency parameters, especially without any rationale for why that was something done, is something that we will not cover, and your claim is likely to be denied. So remember, if the vitamin D test comes back within normal limits, typically this is not, it would not be something that we would expect providers to then retest with that same test for. So again, unless there is a clinical indication to retest a beneficiary for results that were within normal limits, an additional test would typically not be something we would approve. If the provider, again, does provide that additional test, there should be a clear rationale somewhere in the notes to show the provider's reasoning and medically necessary support for that clinical decision. All right, and that leads us to our final documentation error, testing for routine purposes. So as you can see from the gentleman's disposition on our slide here, testing for routine purposes is a no-go. It's a thumbs down situation. We do see this more often than we think with these claims submitted, as well as during our current TP reviews for this service. So again, this is not a standard test that Medicare will reimburse. It does need to meet the coverage criteria that is in our LCD. So again, that includes clinical rationale, clinical indications listed, and meeting those frequency parameters that we just talked about that WPS and Medicare outlines for this service to be covered. So pretty straightforward with this one, but it is something we do see fairly often, so we wanted to just highlight that this morning. Okay, all right, so that brings us to the example section of our webinar. So these next two examples that we'll look at are from past TPE reviews, and we blurred out some of the private information for HIPAA reasons. So that is why you see some blurry or black information as I go through these notes. And I said this at the beginning of our presentation, the original notes for the claims that I'll talk about had a lot of extra information, a lot of other lab tests, a lot of other just ordering information. So I did screenshot the relevant stuff for vitamin D testing. That way I don't have to scroll through 50 pages, give you guys all a headache as I go up and down. But we, again, took some screen grabs of the areas we want to highlight. So here's our first example. And first example, we have the provider order for vitamin D assay testing. Again, that PHI information is blurred out, but the info we do have with this order is the provider's information, so who's ordering that test, what test is ordered, the date that it was ordered, and then it was cut off in our screenshot, but we do have the provider signature that was within the notes as well. So it didn't fit on this page for you all to see clearly, but it was there. The diagnosis listed for the medical necessity of this test. What we have here is vitamin D deficiency unspecified, and again, that test date is included, which is 4/14 of 2023. All right, so next piece in the result history for example one that we wanted to talk about is some information about this beneficiary's results history and some past vitamin D tests that they've had. So this tells us that this beneficiary has received a vitamin D assay test on 4/14, and they have a low result in just barely reaching that deficient level of 19.2. The range, as you can see here, is below 20, or 20 or below would qualify that deficient range. Prior to that, on 1/27 of 23, they also received a vitamin D lab, and this time, however, got the result of 31.2, which is actually in that sufficient range. And then they were tested again on 5/6 of 2020 or 2022, and the result of that was also in that sufficient range as a 30.4. So the test that was most recently done does show a deficient level, but for this to be covered, we would want to see somewhere in the note that there was a clinical rationale to support testing again, because the levels that were done prior were in those sufficient range. So I'm going to go to our progress note and we'll see if we get a little bit more information to support that. All right, so this provider starts the progress note section by discussing the results reviewed relating to a prior sleep study. Not really something that relates to vitamin D, but moving on, it talks a little bit more about the patient having symptoms such as fatigue, weight gain, hypertension, and forgetfulness, which again, this provider is linking that back to likely poor sleep. They next discuss a possible diagnosis of Cushing's disease. However, it's not something that is confirmed, and there's no mention that any other follow-up testing to look for or rule out a thyroid disease is being ordered. They talk about completing a certain regimen for strep throat, and then finally some concern relating to high blood pressure that they discussed during their visit. So nothing in this progress note provides us any clinical indication from this provider to give us any insight to have to know why they ordered a vitamin D test in April, especially when we consider that the test done back in January of that same year was within normal limits for vitamin D. So here in this progress note, we're missing the why or the clinical rationale to support the test that was performed. All right, and so that brings us to the rationale and the results of this review. So in example 1, this is something that we did have our reviewers did deny based on the information that was provided. And we included the reviewer's rationale for this denial on our slide. For this claim, the patient has a history of vitamin D deficiency, and is not currently on any vitamin D supplements. They had 2 prior vitamin D tests within the year of that date of service requested. So in this case, we're talking about a claim for the one in April. Both of those prior tests, as I said, came back normal. And because of this, there was no reason for additional vitamin D testing to be performed. All right, so I will pause for questions once we get through our second example, but I want to move into that first. Okay, so on to example 2. We have a screenshot again of the vitamin D orders. These look a little bit different, but we have same information, so ordering provider, the date it was ordered, and then as the case with our other one, signature did not fit on this slide, but it was included in the overall notes. Documentation for this example is that, or I'm sorry, diagnosis for this example for this patient. This person had quite a good list. Included here, they have iron deficiency anemia, hyperlipidemia, GERD, or gastroesophageal reflux disease. And then the one that was listed next that didn't make it on this slide, and this is the one that meets the clinical indication, is chronic kidney disease stage 3. So that, again, chronic kidney disease is one of the clinical indications listed for vitamin D testing in our LCD. All right, next we have result history. So this person has only had 1 recent vitamin D test, and as we can see, they do have a notable vitamin D deficiency. They resulted with a 16.8 level, and that is a good amount below that benchmark of the 20 for a person to be deficient. All right, so so far we have a low level, we have a diagnosis that meets the clinical indication, and let's see what other information is in our progress note. All right, so first thing here is, again, that diagnosis. So this person is diagnosed with chronic kidney disease stage 3. Again, one of the first indications listed in our LCD for this service. Reading on, it also looks like this beneficiary is due for a bone density scan. So as I mentioned prior in some of our beginning slides, bone issues, bone weakening, maybe some common frequent fractures would be a sign that a person is having some vitamin D issues. They also have a history of postmenopausal osteopenia. This person was on a medication used to treat osteopenia, and as you see from our progress note here, the provider is stopping this and does plan to add in vitamin D as well as calcium daily supplements. So the other thing I want to point out with this note that's not included in this actual screenshot is that, again, this person did not have a vitamin D test recently completed. All right, so as you probably could guess from the information that I've reviewed, this example was something that we approved. So the reviewer's rationale is included on our slide here. It's based on the diagnosis of obesity and mainly chronic kidney disease stage 3. Indication for this test was met. We received the necessary documentation to support the claim, and as well as that service that was provided. Info that we received included lab results, the medication list. I did not include that, but that was something that we did receive and had a lot of good information on that. Physician order as well as the progress note. So pretty, I think, clear cut between the approved and denied example based on our LCD information. All right, and so before we pause for questions, here is our slide for some resources and what, again, links that we talked about as I went through our slides. There might be some issue with that LCD link on the Medicare side, so hang tight with that, and they hopefully will resolve that soon if you're trying to get to that and it's giving you any errors. All right, so I want to pause now for questions. I peeking in the chat, I don't see anything, but I wanted to open it up to Mary Sue or Jennifer. Is there anything that has come through?
I don't see any questions right now in the chat, Rachel.
Okay, sounds good. If you do think of anything as I kind of go through these next few slides, please put those in and we can get you, take a look at our questions. I will go through the rest of our slides here and probably give you guys a few minutes back. So here's our survey. If you've attended any of our presentations recently, we talk about our survey at the end and hope that you do take this. We love all of the feedback we receive with these surveys and want to know other future topics we can talk about for, maybe medical review or certain services that you have questions on documentation related issues, or, maybe you've had something that you think could be better explained and you'd love to see a webinar on that. Or if you like the documentation examples, we want to see more of that, please let us know that as well. So we really love the feedback with these surveys, and it helps us make sure that we're providing, effective, timely education for providers to give you all the information you need, and make sure that we're hitting the pain points, I guess we'd say, for our provider community. So that is all I have today. I want to thank you for sticking with me this morning, and on behalf of myself and our provider outreach team, thank you for our participation. You may now disconnect.